Okay, so if you've watched any of my other videos, we've been talking about taking vital signs. Vital signs can include your pulse, your blood pressure, and then respirations, along with a few other things. So when we take respirations, we're going to do the same thing as we do with a pulse. We want to calculate what that respiratory rate is for 60 seconds. For an adult patient, that normally is going to be somewhere between about 12 and 20 breaths in that 60-second period. So when we do that, we're going to, similar to a pulse, we're going to count those respirations for about 15 seconds and then multiply them by 4. Or you could calculate it by measuring it for 30 seconds and calculating it by 2. So several ways they're going to do that. First of all, we know that chest rise and fall is what we're looking for. And so I can sit here and watch his chest rise and fall for that 15 seconds. I could put my hand on there if the breaths are really shallow, watch my hand rise and fall, or I could use the stethoscope and simply take that and place it on the chest and then listen. And every time I hear him take a breath, count that, and again, calculate what I have at the 15 or 30 second mark to determine what his respirations are for 60 seconds. While I'm doing that, after I'm finished, I may as well go ahead and listen to the breath sounds and assess that. And when we're listening to breath sounds, typically we're going to listen into the upper fields on both sides. We're going to listen to the lower fields, usually along the rib area. And we're listening for things like, are they clear and normal? Are they wheezing? Various things there. You could even actually take and listen to lung sounds in the back lobes, up top on both sides and on the bottom on both sides. So that's how we would get our respiratory rate. And again, Steve's been really helpful in this, so we appreciate you, Steve.